My name is Jessica Anker. I'm an associate professor at Weill Cornell Medicine, and I'm the program director for the Health Informatics Master's track. I'd like to tell you today about a research project we recently completed here. I conducted this with my graduate student, Marianne Sharko, our staff member, Hannah Mitchell, and two collaborators from Georgia Tech, Lauren Wilcox and Matthew Hong. We're focused on whether parents should see their teenagers' medical records. As you probably know, most people in the United States today can access their own medical records through electronic patient portals. This is an online system that gives you access to your physician's office and information from your own medical record. Through these systems, many parents have gotten accustomed to accessing their children's medical records so that they can keep up to date on vaccines and upcoming medical appointments and message doctors. For young children, this is very routine and not a problem. For teenagers, things start to get a little bit tricky because the privacy rules and the privacy laws and the privacy practices are a little bit different during adolescence. Adolescents are often encountering some difficult issues for the first time. They might go to their doctor to seek some advice about reproductive health, sexual orientation, drugs and alcohol, mental health, and all sorts of other issues. If the teenager does not think this discussion is going to be confidential, the teenager will often just withhold that information from their doctor, or there's even evidence that some of them will skip their medical appointments altogether. For this reason, medical societies that focus on adolescent medicine strongly recommend that adolescents be given the opportunity for some confidentiality in their discussions with doctors, even when it comes to protecting their privacy from their own parents. This could be a potentially controversial issue, and so we had an opportunity to conduct a nationwide survey and to find out what the public thinks about these issues. The Cornell National Social Survey is an annual survey conducted by Cornell University, and we were able to insert some questions into this telephone survey. We conducted a randomized experiment with the survey. Half of the respondents were asked two questions in what I'm going to call order A. The first question is, should the parent be able to see a 16-year-old child's entire medical record? And the second question was, do you think a teenager would be less likely to talk to the doctor about sensitive issues if they knew that their parents could see the medical record afterwards? So that's order A. The other half of the people in the telephone survey got the same questions, but they got them backwards. That's what I'm going to call order B. What they got was, first, the teenager withholding information question, and then second, should the parent or guardian be able to see their 16-year-old child's entire medical record? So you can see everybody got the same questions, but half of them got them in reverse order. Our first hypothesis is that most members of the public probably do not support adolescent medical confidentiality, at least from their own parents. Our second hypothesis is, if we present people with the primary argument in favor of confidentiality, maybe that will increase their support for this idea. And in fact, we did find hypothesis one was supported. Most respondents thought parents should have full access to teenagers' medical records. However, hypothesis two was also supported. It turned out if we reminded them that teenagers might withhold information from their parents, support for parental access to medical records fell substantially from 77% to 69%. We conclude that there's a big disconnect between the public and the medical center. Most medical centers in our previous research we've found that most medical centers do protect teen confidentiality in at least some way. And many times parents are surprised and distressed to learn that they can no longer access their children's medical records during the teenage years. However, we found that nudging people, prompting people to think about the teen-doctor conversation and the potential confidentiality of that did change some minds and make people more open to the idea that maybe teenagers should have confidentiality. So we thought that this, moving forward, we'd recommend that this might form the basis of some sort of education or transparent discussions in the electronic patient portal policy for both parents and teenagers. If you're interested in finding out more, you can find our article online. Here's the URL. and I'd also be very happy to answer any questions about it. Thanks so much.